It seems like most of my patients that need crowns are experiencing some form of space loss. What is the best way to approach these cases? So normally in pediatric dentistry, right, we try to put on a crown. There's been a little bit of space loss, so you try to put a 5 on, and it fits mesial distally, but it doesn't fit buccolingually, so we have to go up a size to say a 6. Well, the 6 now fits buccolingually, but it doesn't fit mesial distally, right? So we ask for the Hal plier, we squeeze that 6, because buccolingually it's a 6, mesial distally it's a 5, and we modify the shape of that stainless steel crown to fit that specific case. Well, remember, zirconia does not flex. Problem. Solution? Space loss crowns. We decided to make a space loss version of our crown that had the same morphology buccolingually, but that was squeezed in mesial distally. So when you have those cases where there's space loss, remember, you can use, if you're doing back-to-back crowns, you can use a regular and a space loss. You can use both space losses. You have options. I'm struggling a bit in back-to-back first and second molar cases with severe space loss. Any tips? Well, don't think about a back-to-back case as being any more complicated as a single unit case from the preparation standpoint. And what I mean by that is, remember, you want to do the same steps whether you're doing a single unit or whether you're doing a back-to-back unit. So do the same thing: occlusal reduction, supragingival reduction, subgingival reduction. If you do those steps on each tooth individually, you should be able to seat them. Now, the problem comes is when you try and they don't fit. So there are a couple things that we can do to help out with that. One is, remember, the red crowns or the space loss crowns, they're about a 0.5 millimeter to 1 millimeter overall narrower mesial distally. So by going from 2 blue crowns to a blue and a red, or to 2 red crowns, you have the ability to play a little bit with that space. Sometimes they're really, really tight, and especially if you're working with a child that's, say, a 7-year-old, that their 6s are in and their cuspids are still in there and you're kind of tight in there, those are a perfect case where you might want to use 2 space loss crowns. Now remember, you can also disc a little bit on the distal of that cuspid and mesially shift them a little bit to give you a little bit more space. Rarely are we going to ever want to touch that distal molar, right? So that 6-year molar, we don't want to touch that at all. So those are the cases that you're going to probably end up doing 2 red or 2 space loss crowns for. I don't see a mandibular canine option for EZCrowns. Does Sprig not offer these? Well, we do offer them, but the lower cuspids are a little bit different shape than the upper cuspids. They're a little bit narrower mesial distally and a little taller incisal gingivally, which just happens to be the exact combination of what our space loss crowns are. So when it comes to lower cuspids, you're going to want to do the contralateral upper cuspid in the space loss version, and that's the one that's designed specifically for the lower teeth. So remember, C goes to M, H goes to R in the red versions, and you should have no problem restoring those wraparound caries on those lower cuspids. Got questions, comments? Feel free to leave me a line either in a comment below, or you can email me at askjeff@sprigusa.com. We'll see you in a couple weeks.